Good morning, everyone. I think we'll go ahead and get started. We anticipate a full room, so we'll probably have folks sort of wandering in as we get going. So I'm Dani Fallin. I am the chair of the Department of Mental Health here in the Bloomberg School of Public Health at Johns Hopkins. And I have the privilege of helping to lead a department that houses the Moore Center for the Prevention of Child Sexual Abuse. And that has been indeed a great privilege, and this is my second year getting to start us all off, which is also really fun for me. And I have to say that the center, in addition to the role it plays in our department and our school, has a very special place in my heart in its approach. I am an autism epidemiologist, and so my work in the context of public health and autism has really focused, and our center's focus is on thinking about how to prevent autism or how to prevent the consequences of folks who are on the spectrum, as opposed to solely focusing on the treatment once someone has autism. And this idea of if you could stem the tide and prevent things from ever occurring, you really could make an impact that is quite meaningful. And that's not to diminish the importance of folks who really think about and push the treatment envelope as well. I think those are important goals simultaneously. But I'm happy to see folks that pay attention to this concept of prevention, and particularly in the setting in which the Moore Center has done this. And so for me, that approach is very near and dear. And so I would like to introduce the director of the Moore Center. Dr. Elizabeth Letourneau is an associate professor in our department. She came to us after many years of experience in this field as an associate professor at the Medical University of South Carolina. Her original training was at SUNY Buffalo and then at Illinois. And then after doing some sort of postdoctoral work and a couple of other things, and then spending a first part of her career there, we were fortunate enough to recruit her here in 2011 to direct this center. And it has been a great opportunity for her and for us ever since. And I think you'll see today the kind of work not only being done here, but being done in the field, and the connections that are being made, and the vision for this center moving forward. And I'm very excited by the amount of attention and interest in this symposium and in the mission of the center. So welcome, Dr. Letourneau.
Thank you, Dani, for those warm and welcoming remarks. Good morning. Good morning. It's great to see everybody. We have a wonderful day planned for you. I'm thrilled to note that this is our third annual symposium, and our in-person audience is our largest yet by a wide margin. We'll fill up over the day, but we are 200% more than we've had in the past, so I'm really excited about that. And for the first time, we're streaming to a virtual audience. And so thank all of you for joining us today. Before I get too far into things, I want to draw your attention to some materials that we've prepared for today's event. And these are also available online for our virtual audience members at the same link that you used to sign in. On the right side of the folders are symposium-related materials, so you have an agenda for the day, some note pages, and you have some blank note cards. You will have an opportunity to submit questions for a panel that will occur at, just after we return from lunch. We recognize that much of what we talk about is very sensitive. We look forward to a very civil discourse, but we don't have an open Q&A. However, you will have the opportunity to submit questions, and then we'll select from those to present some questions to the panelists and to Luke Malone, who I'll talk about in a moment. We also have some lunch options for you for some nearby restaurants, and a very brief survey. We are committed to providing the best possible symposium, and we really would like your feedback. So please, if you could take a few minutes to complete a 5-item survey anytime before you depart today, we would appreciate it. And then we also have a handout from our friends and partners at the University of Oklahoma National Center on the Sexual Behavior of Youth. This is a phenomenal public resource, and we are happy to highlight their work. It's a resource for parents, for professionals, and even for teenagers. On the left side of your folder are some center-related materials. There's a 1-page description of the center, and I'll talk some more about the Moore Center in just a moment. There's also a center wish list suggesting ways you might consider supporting our work. And there is our annual report from 2014, which illustrates much of our recent accomplishments. At the end of the day, I hope that you, like us, will leave with the sense that child sexual abuse is not inevitable, that it is it's a preventable public health problem. And toward that, I'm going to describe a little bit about some of the work you'll hear that the center is conducting to move us forward, to change the conversation from inevitability to prevention. You will hear speakers talk about our prevention research and some of our policy endeavors. With respect to prevention, Dr. Tamar Mendelson will describe our efforts to develop a parent-focused program to encourage the healthy sexual behavior of children starting at a young age. Dr. Cindy Schaefer will describe our efforts to develop a school-based prevention program aimed at all 12 and 13-year-old students and their parents. And I will describe a collaboration aimed at developing a prevention intervention for adolescents who are sexually attracted to young children. And I'm delighted that Luke Malone, a journalist who wrote about such adolescents for This American Life, joins us to present on his award-winning journalism and reporting, and also joins us to moderate a panel with a couple of very brave young men who are attracted to young children and committed to never acting on those attractions. With respect to our policy work, Dr. Andrew Harris will describe a project that we've designed to better understand the actual effects of juvenile sex crime policies. And Dr. Ryan Shields, my friend and colleague at the Moore Center, will describe a newly funded project in which we are examining the impact of state safe harbor policies that aim to shield juvenile victims from sex trafficking charges. We are, of course, mindful of the many effects that child sexual abuse has on victims and even on offenders. And Dr. Candice Firing will describe her work on the effects of child sexual abuse on children's compensatory behaviors. And our colleague and symposium co-host, Dr. Fred Berlin, will present a case report on an individual whose own victimization played a role in his later offending behaviors. Our symposium ends fittingly with comments from our center's founding donor, Dr. Stephen Moore, who will describe why he and his family are committed to the prevention of child sexual abuse. It is my hope that by the end of the day, you are convinced that child sexual abuse is an entirely preventable public health problem and that you will join us in our prevention efforts.